Hello everyone, my name is Matteo Consonni. I work as Business Creation Manager at EITL Germany. As you all know, we are experiencing very unpredicted times with the COVID-19 outbreak, but at least this is giving us the chance to spend some more time talking with our startups. This is actually why we decided to start a series of online interviews with some of the teams that we have been working with. And today is particularly special because we are talking with a startup that is working on the front line of the corona outbreak. We are here today with Veronika from Climedo. Hi Veronika, how are you?
Hi Matteo, I'm good, thank you.
You want to introduce yourself and give us a short overview of what Climedo is doing?
Sure. Yeah, so I'm Veronika, one of the co-founders of Climedo Health, and we actually founded the company in 2017. And since then, we are already in touch with the EIT Health when we were one of the lucky winners of the Head Start program back then. And since then, we've been in great contact with the whole community, and they always gave us very valuable input and made some very great connections. Maybe one sentence about Climedo. We offer a web-based platform for clinical data collection in order to accelerate the validation process of medical devices to ensure that the devices are safe and effective before they enter the market, but also for their post-market surveillance purposes, which are now actually very important with the new medical device regulation, the EU MDR, which is taking effect probably next year, May.
Okay, well, sounds very clear. Thanks, Veronika, for the explanation. So, what made you decide to offer your solution to the wider public in the corona times?
Yeah, so on the one hand, we felt that we have a moral obligation to support people in the crisis, such as many other startups and other companies are currently doing it. So we are really happy to see that there are so many people and institutions currently helping with the best of their resources. And we also thought that, okay, we have the resources already there. We have a platform, we have digital tools. Why not actually use them for the higher purpose to fight the crisis? And so, we decided to use our platform for clinical data collection, exactly for the use case, in this case, rather for academic research. So that's why we decided to help, and happy to be back in the academic world because that's actually where we also come from.
Sounds great, and I also think it's really important. So, how exactly is Climedo helping in this frame?
We are offering our digital platform for clinical data capture free of charge to all research projects which are related to COVID-19. This means that hospitals and research groups can track coronavirus patients in a very consistent and digital way, and they can use the data that they gathered to make important decisions about next steps. And all relevant parties can access the anonymized data, meaning that no paper documents need to be sent back and forth or no manual data entry has to be done. And this saves a lot of time and effort, and of course, time is currently the most important currency for everybody. On a patient level, we are offering our e-diary solutions to patients who need to stay at home. And so they receive regular questionnaires via a link and can easily complete them from the mobile phones or computers. That means that they do not need to travel to a clinic to participate in the studies.
Yeah, sounds very interesting and definitely extremely valuable. So, do you have already some results and about how are people responding to the offer?
Yeah, so we were quite overwhelmed by all the positive responses and requests that we got. We are now in touch with several institutions and university hospitals and even medical device companies who are all involved in COVID-19 related research, and some of them are also offering their own devices to support patients in hospitals on intensive care units. So it's really great to be able to support them to collect data and see the efficacy of those measures. One concrete project that we have is also that one acquaintance of mine from the Zeppelin University in Friedrichshafen is currently using Climedo to track the psychological effect that the virus is having on people who have to work from home, even though they do not have coronavirus necessarily. The study is called How Are You Today? And everybody can actually participate, which might be a nice way to also experience our software and see how the questionnaires look like and how to enter data very easily.
For sure, sounds great, and we'll definitely do. So, in general, I think it's great to see that young and promising startups such as Climedo are putting their efforts in contributing to the situation that we are all experiencing with the COVID-19 for the benefit of patients and citizens. So, what can people do if they want to get in touch with you, either to make use of your solution or to support you?
Yeah, so even though we are all working from home currently, it's still easy to reach out to us on the digital way. So they can either write us an email to covid19@climedo.de, which is an email address that we set up for those purposes, or they can just reach out to us on LinkedIn, for example. And yeah, no matter how people reach us, we'll make sure that they get then connected to the right person at Climedo so that we can discuss the proposed project as quickly as possible and roll it out fast.
Great, sounds great. I'm sure many people will get in touch. So, well, thank you very much, Veronika, for your time and for the answers you provided. Stay healthy, and we look forward to meeting you in person soon.
Thanks a lot for having me, and stay healthy, you too.
Thanks, Veronika.
Bye.
Speak soon. Bye. Ciao, ciao.